you and I have a lot in common, I think. We're partners in the same practice. We both have children. I know you over the last couple of years at Orthopedic Associates as being a very humble person. So I think, this kind of interview thing maybe is not our sweet spot of comfort, but tell me about your kids and, what makes you stay so humble. I think parenthood is one of the most humbling things we can go through. Tell me about that.
Yeah, I think like you, I have 4 kids.
The chaos.
Yeah, to the point where one of our partners joked that I should switch over to foot and ankle, because I think most of the foot and ankle surgeons in our group have
it's a
have
prerequisite
kids,
in our practice.
More than 3 kids. So yeah, most of my kids are all young. Oldest is 11, youngest is 3. 3 girls and then a boy. So it's super busy right now. Obviously all the kid-related activities and which I'm abandoning right now. So just figuring out all the moving parts and trying to get them into all of their rehearsals and practices and games and things like that. I'm sure
Total chaos, yeah. So we share that, and we're both at Orthopedic Associates of Hartford, both, although different specialties, orthopedic, foot and ankle, and physiatry, kind of focused on similar aspects of musculoskeletal healthcare. And then, in kind of reflecting on this interview, I was thinking to myself that despite all of those similarities, you have done 2 things that I have never done. And one is to encounter this major medical event, life-changing event that involves open heart surgery. And then the second is having a broken foot and running a distance endurance event on a broken foot. So tell me about that, those 2 things. What would you say?
Yeah, it's obviously been a crazy kind of life-altering year and a half. So too much to summarize in a few minutes here, but started when I found out I had a congenital heart condition a few years ago, aortic stenosis and an aneurysm of the ascending aorta, and was told at the time that eventually it would need to be repaired. So we were monitoring it for a while, and then it kind of unexpectedly progressed faster than we all thought it would. So I was told in the fall of 2021 that surgery needed to happen sooner rather than later, and that 2-year mortality had increased to the point that it was concerning. So long story short, I really tried to hasten the process and get things done, rather quickly. I figured if it's going to happen, let's get it done. But a lot of balls to juggle, getting my practice, in order, and getting my family set up, getting multiple opinions, and figuring out a lot of surgical decisions that had to be made that were really, really challenging. And I can elaborate on all that later, but so wound up having surgery in November of 21 and spent a long time recuperating from that. Came back to work a few weeks later, probably earlier than I should have, but really kind of slowly returned to kind of a full duty work status over a few months.
I would just interrupt and say, number one, that's something that most humans don't go through. And as being someone who is new at OAH, maybe there for about a year when this unfolded for you, I'll just share with you that 2 things, really struck me. One was how incredibly put together you were as you presented that dramatic, left turn in your life to the group. That your composure really struck me. And then, along with that, I was really intrigued and fascinated and kind of uplifted to see how our organization, OAH, kind of wrapped around you and tried to support. What's your memory of that incredibly chaotic time relative to OAH? At that point, you've been with OAH longer than I have, for 8 or 9 years at that point. So what about that struck you?
I guess I must have a better poker face than I thought, but no, it was really just kind of overwhelming, all the support that the group provided. I think that was really one of the highlights of the experience, really. I had shared with a couple of members of our executive committee early on, a couple of years ago when I found out about it, just to kind of say, hey, this is eventually going to come. I just want to make you aware. I don't know how this is going to impact the practice. And right away, they were just immediately supportive, whatever we need to do to kind of keep you afloat and keep your practice intact and not make it a burden on you or the family. And then when it finally did come around, it was, one of those, situations where how much do I disclose to everyone in the group? I basically try to fly under the radar, keep to myself, and but I felt like it was better to share that information with all of the providers in the group, just to explain, hey, here's why I'm not going to be a part of my practice for several weeks and not at full steam for several months, just so they don't think that I don't care or that I'm abandoning patient care. And so I decided to disclose all the details to the group, and was just really overwhelmed at all the support that I received. Almost every single provider reached out, whether it was just to share words of encouragement or, some of them contributed to like a meal train, laundry. The group was just very supportive in keeping my practice afloat. Even, Jason DeCruz, for example, Dr. Zoe's PA, volunteered to just kind of help see some of my patients, which was just, without even asking. So things like that, just across the board, really just made it, just drove the point home that this really is a family, and what we do transcends, the practices that we run and the kind of business of medicine also. So just really touched upon that personal component of things.
We are so oftentimes locked into the pace of our schedule and trying to meet the demands of our community as people come with their own kind of left turns in life. And it strikes me that a lot of what we do in our specialty involves people who find themselves suddenly in a totally different situation than they imagined themselves, right? It's a step off a curb or an unfortunate accident or a kind of a acute pain flare, and they come to us wanting to know, like, what next and how, what decision should I make? And you were just really in kind of a similar fashion to a lot of patients that we see, kind of your script flipped, pretty dramatically, right? Maybe not in terms of orthopedic injury, but in terms of all of a sudden having to make these, really important life-shaping, life-altering decisions in a way that you weren't expecting to have to.
Yeah,
to do.
and it's funny that I think that really began my kind of journey as just a patient, right?
Yeah.
Obviously as a physician, I have the medical knowledge, the ability to scrutinize literature and things like that, but cardiovascular surgery is very far removed from from what I do. So right. I could do all the medical research that I want to do. A lot of in many cases it just kind of came down to consulting with other patients. There's lots of support groups out there, patient forums. Really just trying to collect information on other patients' experiences and trying to make the best decision for me, because there are lots of variables to how to approach the surgery and how to navigate things long term.
Which is right where our patients find themselves, right, in this kind of foreign world of orthopedic surgery or physiatry, and they're they have a vague sense of their own anatomy, but we're coming at them with some technicalities and some verbiage that is totally foreign to them. Did you find yourself a little lost in the technicalities and language of cardiothoracic surgery?
Oh yeah. I mean, it's there were surgeries that I didn't even know existed.
Right.
That were actually offered to me.
Right.
And so I had to really get into the weeds on that.
Yeah, and as you're trying to sift through that, it strikes me that a lot of our patients are trying to do the very same thing in their own process with their own orthopedic injury, and I'd like to think that our patients are kind of relying on our professional sense of things, and I'm sure you're doing the same, offering patients resources to do their own research or, second opinions, within our practice or outside the community. And as you were trying to make those very granular decisions, what did you find yourself relying on as a patient, to help you make those decisions about your healthcare?
I think honestly, it was me. Just kind of knowing the way I am and how I would, what would make me most comfortable long term, because there were pros and cons to all of the decisions. So I got information from multiple surgeons, other patients, and just tried to, and realized in the end, my cardiologist, I have to give him probably more credit than anybody else. Mm-hmm. He spent a lot of time discussing things over with me. And he basically said, he goes, I don't think you have a wrong decision in how you approach this. Yeah. And that was really the take home point. And so I just kind of said to myself, all right, what is going to make you the least stressed, the least anxious, moving forward? Yeah. And that's really what drove my decisions.
Yeah, it's fascinating, to think about how medical and surgical decisions are made. I think a lot of patients come to that process kind of assuming that there is a right answer and that there's only one option. And, in medicine, in every specialty, it turns out there's always more than one, surgical option, which means that none of them are perfect, right? And so how do patients kind of find the right balance of maybe taking their physician's advice versus, kind of analyzing where they are, in their life, their timeline, and kids and family and obligations and athletic interests, and how do you choose the procedure that, kind of fits or is tailored to their lifestyle, to their comfort zone. And you were in the thick of it, trying to do what our patients do every day when we see them. Yeah.
Yeah. It's funny. I remember going to one of my post-op follow-ups with my cardiologist, and this was like 4 weeks after the surgery, and I was pretty frantic. A lot of different variables, different experiences that has happened, different concerns, and I know what it's like to be on the other side of the fence, right? Where you have a set amount of time, you have a busy waiting room, but on the flip side, I had all these questions, and I was that patient who came in with like the list, and I said to myself, I have to make sure I do this very quickly, because you don't want to belabor it. So just get to the point, get your answer, and move on. So it was just interesting knowing, okay, now I know why patients come in with these lists, because I get it.
Yeah, for sure. It's so important. And we do feel the pressure of the schedule in our daily life, but it's so valuable. I mean, I can imagine that you are a better doc having been through that as a patient, in terms of understanding both sides of the script and the details of decision making in a way that you can't know it until you've been through something like that, right?
Yeah, and I'm obviously it can be hard to tell patients who are sitting there asking you, well, what should I do? And there's sometimes not a correct answer, right? You can't give them a strong recommendation, because there's not going to be one specifically correct way to go about doing something.
Yeah. So you knock that out of the park, right? This open heart surgery, check the box off the list. Don't have to do that again. And then, I still remember when you texted me about your foot injury. I was at a music festival with my wife and my adult children, and I had to find a quiet space, like 2 acres away, so that we could talk on the phone. I'm not sure I was giving you the best medical advice at the time, but when the dust settled and my ears stopped ringing, and made my way back to the office and looked at your X-rays, we had some decision making to make between ourselves, doctor and patient, and I was so struck by just kind of the gravity of what you were trying to do. I want to run a half marathon. How far out from your open heart surgery was this event?
So the event itself was about 11 months after. I guess the quick, kind of summary here is I definitely struggled during the immediate window after surgery. I think the hard part for me was I went into surgery without any symptoms, probably in the best shape of my life. Yeah. And it was hard coming out of that, literally coming home with a rolling walker, like barely able to walk. Spent the first few weeks literally just on a walking program, not able to lift, not able to do anything. And that was a struggle. But at the same time, I kind of learned the ability to just adapt, to try to figure out other ways to maintain some type of physical fitness, to try to keep strong and doing, certain activities and classes that I never imagined I would do. Flash forward a couple months later, lifting restrictions come off. I'm starting to feel good. It was probably maybe about 4 or 5 months after that I started to say to myself, I think you're getting back to, the ballpark to where you were before. Not quite there. And then things kind of picked up, and what happened was I've shared this with you. The one activity that I was never really into was running, and I had a couple of good friends who did a half marathon for the first time, and we actually have a text chain together. We communicate about fitness and diet and all that stuff, and they're sitting there talking about their experience training, and it was, I don't know what came over me. It was just kind of like, what, I think I say to myself, I don't like running because I've never been good at it and I've never really tried to hit it head on. So it just kind of came to me, what, just do it. Like, these guys are doing it. Use it as an excuse or an opportunity to try to tackle something that, you're not good at and you've claimed you don't like. In addition, my wife has always talked about wanting to do the Hartford Half Marathon. So without even telling her, I was like, all right, I'm signing us up. So I signed us up, I think, in June. So this is like 7 months after surgery.
That's crazy.
And, we had a few months to train and started getting into it, actually started enjoying it. And my goal went from, okay, just finish this thing, to like, okay, just maybe finish it in like under 2 hours, to, all right, now I actually developed like a goal for my time, which is not going to be anything great compared to, your avid runner. But for me, I was really kind of set on trying to get under an 8-minute mile for it. Wow. So really kind of pushed the pace. 6 weeks out in August, was outside on a long training run, rolled my foot, immediate pain, kind of knew it wasn't good, but I was kind of hoping for the best. So I actually finished the run knowing that I was like, my thought was, what, if this is bad, I'm done. Yeah. If it's not bad, I might as well get this training run in and get, and then once I stopped the run, that's when it was, evident to me that things were not good. Yeah. And so I was pretty frantic. And I think one of the luxuries that we have in our group is that we have, multiple specialists, right? For every specialty. Yeah. And, like anything else, we have almost 30 docs in our group. It's we cross paths pretty frequently. So you were kind of the first person that I thought of, because I know, I see you all the time in Hartford, and then I felt bad texting you like on a weekend.
Yeah, right.
Didn't know that you were away. So, but yeah, and then went to our urgent care. Right, I went to our urgent care first before I reached out to you. Yeah. So that was my first thought. When I got home, I figured this is not good. I should probably go to our urgent care. So I just went right there, and my first time going there as a patient. So that was a great experience. I mean, got right in, got x-rayed, was able to look at my x-ray immediately, knew already, even though, I've shared with you, foot and ankle was probably like my worst specialty, but even I can see that it was broken.
Broke is broke, right?
Yeah. So, they got me fitted for a boot and recommended that, I talked to one of our specialists, and then it went from there. And, both you and Ross Benthine, who I see, we cross paths also, were very helpful in navigating the decision-making process.
Our office party is not a bad place to break your ankle, right? I mean, you're going to have some immediate advice and feedback, right? So, if you have to go through an orthopedic injury, but the timing, it's really couldn't be worse, right? I mean, you've got this, what I would consider or kind of envision this almost heroic return, right? Like who would bet a nickel that a year, not even after an open heart surgery, this guy's going to be running a half marathon? And then this, it kind of speaks to just the vagary of orthopedic injury, right? It just happens, at the worst time, always when you're least expecting. We see patients go through this all the time, and then all of a sudden, here you are again trying to make decisions about, well, what are my options? What can I do? And these are much less life-threatening decisions that you're making. But I kind of thought of that when I heard what you're trying to do. Like, this guy he's got to run this, right? Like, he's got to finish this. It's so kind of symbolic of a return to robust athletic health after such a threatening uncertainty of cardiac health issues. So yeah, for me, there was no way I was going to tell you that you can't run on this. But I didn't think you were going to call my bluff. You were like, oh, really? Okay, I'm going to keep running on it.
Well, I think you kind of hit on it. I think for me, it had become really symbolic. Like, the race was occurring just short of the 1-year anniversary of my surgery, and so it did kind of mean a lot to me to try to pull it off. And I went from being in urgent care thinking, okay, I came home and I told my friends, my wife, like, I'm out of the race, like, it's over. And then when I spoke to you, and I think that's another thing to just kind of highlight here, is that here you are, you're away with your family, and you take the time out to review things. Yeah, you send me the X-rays, reviewing the X-rays from far away. And
are you kidding me? My wife was like, "Where are you running?" I'm like, "Vince Codispoti's on the phone. I got to talk to him. I got to get somewhere quiet." I wasn't going to miss that call.
And I remember you saying, I think that there's you could potentially, once the pain calms down, get back on it. And I remember thinking to myself, okay, so you're saying there's a chance here, So yeah, I think that once I knew that there was an opening, and then I ran into Dr. Benthien a couple of days later, and we discussed it, and he's a runner, as I'm sure you know.
Like, is McDonald crazy? Like, is it?
No, he it was funny because he spoke to me about it and gave me his thoughts, and then I remember as he was kind of walking away, he goes, I mean, if it was me, I would do it. And I actually texted him later. I was like, did I hear you correctly? Like, did you say that you would do it? And he was like, yeah. I was like, all right. Now I've got two specialists telling me that, it's possible. So
and I don't think, it's a good example of how, like, our advice, really does, as we're giving professional medical advice to patients, it really does hinge on the circumstance of the patient, right? And I don't know that I would recommend to everyone, yeah, you should go try to run a half a marathon on your freshly broken fifth metatarsal. But for you and where you were, and your pain threshold, and how important this was for you, and kind of looking at the fracture pattern of your specific fifth metatarsal injury, trying to kind of weigh all that. And like I said, in my mind, there was no way I was telling you that you shouldn't or you couldn't. And but was really wondering if that would actually work for you. So an incredible achievement for you to, pull that off and accomplish it. And then we've been watching this thing heal on X-ray for 5 months, I guess now.
Yeah.
Right. And you and I just took an X-ray a couple weeks ago now.
Yeah.
Right. And for the first time, maybe saw some real convincing bony healing there. I think we were both kind of like, really unbelievable, it's working.
Yeah.
So we'd been through, kind of some anxious X-ray follow-up, waiting for biology to kind of kick in, which is where I find myself a lot, with patients in follow-up, right? Just even patients who aren't my colleague and my partner, just, I think, patients a lot of times kind of expect that we know exactly what's going to happen. And, we have statistics and the luxury of experience and follow up to know where most patients' pathway should take them, but a lot of healing and recovery from medical events and from orthopedic injuries is really determined by biology and all the multifaceted variables that affect that. And sometimes it depends whether our patient was running on their broken foot or following directions.
Well, yeah, I think that's a great point, because as the specialist, you're there to say, okay, there's a couple different ways a fracture like this could go. The specific nature of your fracture is such that it does not require surgery, and you can bear weight on it, and you can resume activity. And I take that information and I process it, and I say, okay, then I'm gonna run it.
I can run.
Right. But I think the lesson that I learned in this process was you really do have to listen to your body, because what wound up happening was I ran the race and I finished it, And, I was happy about that. But in the course of resuming running, the foot was still painful. And consciously, subconsciously, I'm compensating my gait. I'm putting stress in other areas. Began developing some hip pain as I went along. Didn't really think much of it. Just figured, okay, well, what do you expect? You're running on a broken left foot. Your right hip is going to hurt. It's taking on increased stress. Midway through the race, the hip really flared up on me to the point where had it continued, I would not have been able to finish the race running. Calmed down 20 minutes after the race, excruciating pain to the point where I couldn't walk. Couldn't even walk to my car. Next morning, couldn't really walk. So I went back to our urgent care again, and I and got X-rays of my hip, which were fine. But
at this point, I'm out.
Right. So now it's the sports medicine guys who are helping me out, and no improvement. Long story short, wound up getting an MRI of my hip. Turns out I've torn my psoas muscle. And being on a blood thinner, wound up developing a hematoma related to this. And in all of that, the hip was probably, other than the heart surgery, obviously, I think the hip issue wound up being worse than the foot. Because at this point in time, the foot was feeling okay. The hip was excruciating. To the point where in the couple of weeks after the race, I said to myself, I really don't know if this was worth it, honestly. The whole point of sharing that is to say that, I think sometimes you just have to accept defeat. You have to accept the fact that you have to modify or just give your body rest. And even then, in the setting of this hip injury, I said, I'm going to, try to work out however I can. And I finally had a friend who's very knowledgeable to say to me, you need to completely shut down physical activity for 10 to 14 days. And that was a hard thing to accept, but he was right.
And I'll stop you there. And I'll just say, I always tell patients that 1 unit of time in orthopedics or in musculoskeletal medicine is 6 weeks. And I think time just moves, biology moves at a different pace than most normal humans, and especially type A individuals have patience for, right? And that's so humbling when we see patients deal with that all the time. Okay, it's been 6 days, like, let's go, right?
Yeah.
And that's a hard lesson to soak up and learn on the fly. I also wanted to ask you about, you mentioned that early period of post-cardiac healing and how humbling that was. And I see that in our orthopedic patients all the time. These are people who are moving and grooving and then left turn, and their life is totally different. And I often ask people after their injury or their surgery, like, how's morale? Like, how are you doing? And kind of the orthopedic blues, or just the psychological impact of all of a sudden finding yourself not who you were, 2 weeks ago, is really profound, I think, for a lot of patients. What was your experience?
A lot of post-procedure pain, a lot of post-surgical pain. Had a small complication, which is common, pericarditis, inflammation of the sac that surrounds the heart, which made things really, really painful. Those first couple of days in the hospital were a real struggle, pain, mobility. And I consider myself to be a pretty, strong-willed person, but I really needed a lot of motivation from my wife just to kind of get up and get after it. So that was tough. And I think just, having those small things pop up, like rhythm issues and, barely being able to walk afterwards, to your point about morale, it was tough. But I really tried to figure out ways to adapt and to just, do whatever I could. I think that made it a little bit easier to overcome the orthopedic injuries because, with the foot and the hip, it was easier for me to accept, okay, now you need to modify. Now you just need to take a step back and adapt and, try to overcome. So.
Yeah, it's, I'm always fascinated to see how people find the resolve or motivation to kind of get around this unexpected major event in their life, and I see patients kind of draw on their own internal resolve, on their family members, on their neighbor, or their buddy who is giving them a drive or a ride into the office to see us. And it's fascinating from their organizations, right, from their physical therapists, from all the ancillary kind of medical professionals that surround patients who are going through these journeys, and it's really a staggering array of, kind of points of light in these patients' journeys that really kind of illuminate and help, define their path back towards normal. And it really, I'm humbled oftentimes to kind of be a part of that, but there's so many influences that affect, the decision making that we've talked about, the recovery journey, that kind of really, lift and buoy patients to get through these, these big units of time, that are involved in recovering from major orthopedic events and from pain flares. And you've lived it firsthand. You've seen all of that, it sounds like.
Yeah, and I see, we all see, tons of patients who come in, they have many of them are physically active, they have specific activities that they really enjoy doing. And one of their big questions is, how and when can I get back to doing that? Or I don't want to give up this specific component of my physical regimen.
Yeah, right.
And, now I do find it a little bit easier to kind of say, okay, you may not necessarily need to give it up forever, but you probably need to scale back and modify, but figure out another way to enjoy a similar activity, or gradually transition back into doing it by adapting in the short or intermediate term.
Yeah.
So, we talk about making your move. I think there's lots of different ways to do that.
Yeah. Yeah, I like that. That's great. Yeah, it's I think you are empowered, I would imagine, by this journey you've been through to kind of shed some light and some perspective, for patients on how to get through really difficult, unexpected events and subsequent complications, and how to kind of meet your goals, whatever they may be, in ways that involve both internal willpower and external support, and kind of where to find that help.
Yeah, and I think the other side of that is interacting with different physicians, right? Different providers, because I'm in a closed room with a patient. I don't know how other providers are interacting with their patients, but now being on the other side of that fence, I see how my cardiologist interacts with me, how my surgeon interacted with me, how you interacted with me, and really trying to learn from that as a provider myself, and picking up on things that I could be doing better. Yeah. For example, the interest that you took in my situation, and really just kind of showing a humanistic aspect of that, really made me reflect and say, well, this is probably how Dr. McDonald is with his patients, and I probably need to do a better job of at least, tuning into the personal side of their story, rather than just, the objective aspect of things.
And, I thank you for that compliment. And I would say that, I really did some personal analysis as I watched you, kind of handle and navigate the onset of your diagnosis, and how you kind of rolled that out in this super cool and calm and thoughtful and, collected manner. I would have been a mess. It's just, I think, it takes a certain resolve to get through what you got through, and then to communicate it in the way that you did. So it speaks to your personality.
No, I appreciate that. If you were at my house for a few months there, you might have a different assessment. But
fair enough. Yeah. Anything else you want to highlight? It's an incredible story. I think it just is a really it kind of touches on a lot of what we do as musculoskeletal health providers, but in a very kind of personal and unique way. And I thought it was a great. This interview is a great opportunity to just not only highlight your personal story, but also this kind of interaction between having lived an experience that we often coach patients through, and you were the star player.
Yeah, no, I think just all the experiences, the heart, the foot, the hip. I could probably sit here and talk for hours about it. Not that I want to be talking about myself, but just to be able to share that information, with other patients. In hindsight, it allows me. I am appreciative in a way, as crazy as that sounds, because it does allow me to relate to patients a little bit better and to be able to empathize with them a little bit more. There have been times where I've been able to share personal experiences with them now, where they're not sure how things are going to go, how to navigate it, and I can impart, at least my experience. So the ability to just educate, patients and help guide them in a more personal way, I think is, something that I appreciate about the experience. Because even though, I've had surgery, it's not a quote unquote fix. I have to navigate this for the rest of my life. So being able to relate to what it's like to have a quote unquote chronic medical condition as well. I think that's been a valuable learning experience.
Yeah, well, I'm super grateful for you to share that in this way and kind of come out of your calm, cool, collected, introverted self and kind of share the details. It's helpful for me to listen to, and I've learned a lot in watching you navigate that process. And I'm I think, like you, grateful to be part of an organization in a healthcare system and kind of an array of partners and clinicians and kind of ancillary medical personnel that really make our day-to-day workings at OAH not so much like work.
I can't say it any better, and I'm grateful to you for all of your help and support and guidance along the way.
I'm glad that thing's healing.
Yeah, finally.
All right, Ben. Thanks, buddy.
Yeah, thank you.